It is estimated that about 1% of adolescents are affected by bipolar disorder, so it is likely that one or more of your students are affected by this. This video aims to help make you more familiar with the signs of bipolar disorder and how it is different from other disorders. It will also cover what schools can do to help young people affected by bipolar disorder and what services to refer to. Bipolar refers to a mood disorder that quickly shifts between the poles of two extremes. Depression, a sad mood on one side, and mania, high mood, on the other side. In between, there may be short or long periods of relative normalcy. Signs of bipolar disorder include a depressive episode marked by a sad, flat or down mood, manic episodes marked by high moods, extreme irritability. In children, this is a typical form of mania, or it could be a sign of a depressive spell in children. Goal-directed behavior to the detriment of other people's needs, poor judgment, extreme rages that can last for hours, little need for sleep, extreme craving for sweets. Other symptoms include an extreme fear of death, extreme sexuality, oppositional or obsessive traits, hallucinations, suicidal tendencies, and substance use, bedwetting, and severe separation anxiety. In adults, switching between moods can take days or months. In children, the moods can alternate very rapidly, several times a day, or sometimes they can occur simultaneously. Also in children, the manic stage is typically marked by irritability rather than a high mood or euphoria. Most of these symptoms are shown mainly at home. Parents might actually be surprised to hear that their child is a little angel at school, and teachers might be surprised to hear that the child is so difficult at home. Bipolar disorder is often misdiagnosed and is associated with other common conditions such as ADHD. Consider bipolar disorder rather than ADHD if you notice the following symptoms: a strong family history of bipolar disorder or substance use, long temper tantrums and mood swings. In bipolar disorder, the angry outbursts can last for hours, whereas in ADHD, they typically last less than 30 minutes. Bipolar rages typically arise from parental limit setting, whereas ADHD rages are usually from overstimulation. Children with bipolar disorder often walk around with an angry chip on their shoulder. They seem to look miserable for no apparent reason. In ADHD, kids are usually quite fine until the moment that something frustrates them or overwhelms them. Children with bipolar disorder show more oppositional and defiant behaviors. They might show intentionally aggressive or risk-seeking behaviors. Their morning irritability may last for hours compared to minutes in ADHD. Children with bipolar disorder often have separation anxiety, bad dreams, or disturbed sleep. So what can you do at school to help students affected by bipolar disorder? Bipolar disorder is overwhelming, so the key is to underwhelm the student by keeping it predictable, calm, and secure. These children need a reliable, soothing environment. Make routines predictable by letting children and parents know about weekly assignments. Consider keeping a schedule of the day's events on the blackboard. Give adequate notification before making any changes. Allow extra time for transitions or changes. Allow plenty of breaks, planned breaks and whenever they are needed. You could arrange a secret hand count with the student so that they can indicate what their mood is like on that day. Allow and encourage using a minute to reflect before a child makes a choice. Allow the child to pull back when they feel overwhelmed, without asking questions. Have the child sit in a quiet part of the room, and have the child sit next to a quiet and calm student. Some children with bipolar would need the help of an aide. That way, they can quietly tell someone that they're not coping, rather than interrupting the teacher and publicly come over to let you know that they're not coping. Try to say something nice every 5 minutes and try to say 12 nice things for every negative comment. Teach your other students to accept diversity. It can help to teach the other students how different brains can learn and react differently to help them understand the other student with bipolar disorder. Be flexible, be patient, and have a sense of humor. Also, be receptive to suggestions from other people. Communication between the school and the parents is very important. You could share with the parents what strategies work and what strategies don't work. Find out what is happening in their lives, because sometimes this can spill over into school as well. Share with parents what academic areas need more work and which are causing stress or taking too much time. Find out what times of the day make the most sense for particular activities. For example, a child's attention, tolerance, or medication effects might vary across the day. Give the parents feedback on how you think medication is working and if you think there are any side effects. If you have concerns about your student, you could make a referral to the local GP or to your local headspace. If you think it is more urgent and a student is at an immediate risk of harming themselves or harming others, don't be afraid to call the hospital or 000 for help. The mental health team may be best placed to deal with an acute situation.
Created using Powtoon.